Good evening everyone. So in today's class we are going to start with ophthalmology, and in that the first topic being dacryocystitis. Okay, so starting with dacryocystitis, just like we all know, dacryocystitis means inflammation of lacrimal gland and its associated apparatus, mainly lacrimal gland and its ducts. So any inflammation in the lacrimal gland or its duct system, which we are going to discuss now, is called as dacryocystitis. Okay, just like the name says, itis means inflammation and dacryo means lacrimal apparatus. Okay, so we all know lacrimal gland is situated in the upper outer quadrant of the orbit. Okay, and it gives numerous 10 to 15 ducts which will in turn drain the tear or watery secretion, which we say, into the eye, and once we blink it will get spread throughout, and then the tear whichever is there, that will drain through the upper and lower puncta into the upper and lower canaliculi, and from there it will reach a lacrimal sac and then downwards reaching nasolacrimal duct opening into the nasal cavity. Okay, so this is normal pathway of tear or lacrimal apparatus. So all these lacrimal gland, numerous ducts, puncta, canaliculi, lacrimal sac and nasolacrimal duct, all these constitutes lacrimal apparatus. Okay, so starting with dacryocystitis, definition and anatomy. So dacryocystitis is an infection and inflammation of the lacrimal sac, which is usually due to an obstruction in the nasolacrimal duct. So basically the distal pathway is obstructed, leading to collection in the lacrimal sac and that getting infected or inflamed, leading to dacryocystitis. Okay, the lacrimal system, just like we discussed, includes lacrimal gland, puncta, canaliculi, lacrimal sac and nasolacrimal duct. Anywhere the obstruction, it leads to tear stagnation and secondary bacterial infection. Okay, now starting with epidemiology and etiology of dacryocystitis. So as we all know, dacryocystitis affects both infants as well as adults. In infants it is called as congenital dacryocystitis, and it is usually due to congenital obstruction at the level of valve of Hasner. So when in this lacrimal apparatus, the nasolacrimal duct opening, or at the point where the nasolacrimal duct actually opens, is controlled by a valve called as valve of Hasner. So if there is congenital abnormality in this valve of Hasner, so congenitally, since there is an abnormality, this valve will not open and it will remain closed, and because of that reason there will be pooling of secretions everywhere in the lacrimal apparatus, which will serve as a foci for infection, leading to dacryocystitis. And this is the most common cause in case of infants. Whereas in adults it is more frequently seen in middle-aged women, often due to acquired obstruction because of infections, trauma, nasal or sinus surgeries, or it can be also due to chronic inflammation. Okay, so what are the common pathogens which are involved in causing these infections? They are Staph aureus, Streptococcus pneumoniae, Haemophilus influenzae and Pseudomonas species. Okay, now how will the patient present to us? What will be the clinical features or symptoms of the patient? Before coming to that, we need to know dacryocystitis, just like we discussed before, is divided into congenital and acquired. Under acquired, it can be divided into acute or chronic dacryocystitis based on the duration, symptoms, everything. Okay, so what is acute dacryocystitis, what will be the symptoms, and how will the patient suffering from chronic dacryocystitis will present to us, that we will see in a while. Okay, so this is an image showing congenital dacryocystitis in an infant. Okay, where you can see nasolacrimal duct obstruction leading to lacrimal sac as a swelling. Okay, so this, since it is seen in an infant, it is also called as dacryocystitis neonatorum. Okay, so this is congenital dacryocystitis. Whereas a patient suffering from dacryocystitis as an adult will come with the following signs, like a swelling in the inner canthi of the eye, which will be usually painful and tender. So yeah, we'll discuss about the clinical features. In acute dacryocystitis, the patient will present with sudden onset of pain, redness and swelling near the inner corner of the eye, that is medial canthus, and along with this pain, redness and swelling, there will be purulent discharge and there can be possible fever if the infection spreads to systems. Okay, whereas in case of chronic dacryocystitis, it is characterized by persistent epiphora, that is increased secretion of tears because the normal drainage pathway is blocked. So now the eye, or by nature our body, will look for other pathway through which it can excrete tears. So and that is through shedding of tears, and that is called as epiphora. Okay, along with this epiphora there will be continuous mucus discharge and mild swelling, but there won't be any systemic symptoms. Okay, and once we put a gentle pressure over the sac, there may be expression of pus, and this sign is called as positive Roplast test. Okay, so how will we examine the patient? Once if the patient comes with these clinical features saying he is having continuous epiphora, he is suffering from, or he is able to see pus discharge from this swelling on the inner canthus of the eye, and if we gently put pressure over that swelling over the eye, there will be discharge of pus from that swelling, and that is called as positive Roplast test, which is an indication of chronic dacryocystitis. Okay, after discussing about the clinical features, what happens if we don't treat it? If dacryocystitis is untreated, then it can lead to preseptal or orbital cellulitis, or it can lead to abscess formation or lacrimal fistula, or rarely it can lead to meningitis or sepsis also, especially in case of neonates. So how will we diagnose and how will we investigate and come to the diagnosis of dacryocystitis? It is a clinical based on history and physical examination. So once the patient comes to us, we will see the patient and think of a diagnosis, and we'll ask the history, if he has got any trauma, or if it is painful, tender, or if it's not so painful, if there is pus discharge. All this history and physical examination will bring us to a diagnosis. Along with that, the key findings which are included in case of dacryocystitis are pain and tenderness, whereas the differential diagnosis of dacryocystitis will be chalazion or hardiolum, in which chalazion will be painless, hardiolum can be painful. So hence pain is an important key finding. Other than that, discharge from the lacrimal sac will also lead us to the diagnostic clue that there is lacrimal apparatus involved. And in severe or atypical cases, we can investigate and we can go for CT scan or dacryocystography, that is DCG, to come to the diagnosis. Other than that, we can take the culture from the pus which is coming out from the lacrimal sac and send it to the pus culture, and this will help us in treating or in choosing the appropriate antibiotic therapy. Okay. Other than that, Roplast test, which we discussed just before, is an indication that it is dacryocystitis. Okay. How will we manage once we know that the patient is suffering from dacryocystitis? Again, management differs for each type. If it is an acute dacryocystitis, we advise warm compression and a special type of massage called as Krigler's massage. Along with that, we will treat the infection by oral antibiotics. Okay, so now what is this Krigler's massage? So this Krigler's massage is nothing but a technique or a massage where we will mechanically relieve the obstruction. Okay, we will put a steady pressure over the sac or inner canthi of the eye, and we will gradually pull it downwards along the opening or along the nasolacrimal passage. So this will help to relieve the obstruction due to mechanical pressure, and in turn will help in drainage of lacrimal secretions. Okay, so this is called as Krigler's massage. Okay, so warm compression and Krigler's massage and oral antibiotics to treat the infections. If the infection is severe and if the patient is having systemic symptoms like fever and all, then we will go for IV antibiotics. Or if there is abscess also, we will treat it with IV antibiotics. We should avoid probing during acute inflammation or acute infection in order to prevent spreading. Okay, it is very tempting, so patient must be advised very strictly to avoid poking the swelling. Okay, if it is a case of chronic dacryocystitis, it will be treated with surgical methods, like that is dacryocysto-rhinostomy. Just like the name suggests, dacryo means lacrimal apparatus, and rhinostomy, dacryocysto and rhinostomy. Rhino means nose. So from lacrimal apparatus to nose, there was a normal passage, and by this surgery we will create another passage, so that whatever the secretions are coming from the lacrimal apparatus, that will drain into nose through this alternate pathway, and that is called as dacryocysto-rhinostomy. It is a surgery that creates a new passage from lacrimal sac into the nasal cavity. Okay, there are various approaches, like you can use external approach or endoscopic approaches to treat this condition. Now coming to congenital dacryocystitis or dacryocystitis neonatorum, which this usually will resolve by Krigler massage alone. Hence this massage is very important. If on doing Krigler's massage also, if the dacryocystitis has not relieved or resolved even after 6 to 12 months, then we will have to go for a technique called as probing under anesthesia, in which we will probe the valve of Hesner so that it is relieved and the lacrimal drainages, lacrimal secretion, whatever is there, that will be able to drain. Okay, so this was about the treatment of dacryocystitis. Now, what are the differential diagnosis of dacryocystitis? Just like I mentioned before, it can be chalazion or hordeolum, which are eyelid cysts, and if they are involving the lower eyelid, we can think of chalazion or hordeolum as differential diagnosis. Other than that, the complication of dacryocystitis may be preorbital or preseptal cellulitis, which can be a differential diagnosis also. Other than that, lacrimal gland inflammation, which is called as dacryoadenitis. Adena means gland. So dacryoadenitis can also be taken as a differential diagnosis. Other than that, lacrimal sac tumors. Okay. Now, what is the prognosis? There is a excellent prognosis, or we can aram se cure this disease by providing appropriate treatment. Infants will respond well to conservative treatment with 90% resolution by 12 months, and adults, if treated with dacryocysto-rhinostomy, have a 90% success rate. Recurrence may occur if the underlying cause is not corrected. Okay, so at last, quoting a memory aid to remember whatever we studied till now, by a mnemonic itself called as Krigler. So Krigler's massage is associated with chronic dacryocystitis, and you can remember entire class of today by Krigler. Okay, so Krigler, C stands for Krigler massage, R for refer if no response, and then I for incision for abscesses, G for gram stain, that is whenever we send a pus culture, we will do gram stain to identify the appropriate bacteria and then treat with appropriate antibiotics. Lacrimal probing under anesthesia is done for congenital dacryocystitis if it has not resolved even after 12 months. Endoscopic DCR is done for chronic dacryocystitis. Recurrence, if there is continuous recurrence, those patients need monitoring because appropriate or proper cause is not treated yet. And anatomy path can be remembered, that is there is a lacrimal gland, then it opens into the eye with various ducts, and then once we blink, entire tear film will spread, and then it opens into upper and lower puncta, which eventually opens into canaliculi. This canaliculi will in turn open into a lacrimal sac, which will in turn open into nasolacrimal duct. Okay, so this is a gland, these are channels, and then tear film. These small openings are puncta, and these are canaliculi. It will ultimately open into a lacrimal sac, and most of the disease will be here because it is a sac. All the secretions will get accumulated in this sac, and this will serve as a foci for infection, leading to dacryocystitis. Okay, and this is a nasolacrimal duct which is guarded by valve of Hesner. So the pathway being gland, then various ducts, then puncta, then canaliculi, and then lacrimal sac, and then nasolacrimal duct guarded by valve of Hasner. So this is all about dacryocystitis.